Hi, I'm Kristi Bennett, and I'm going to do a health assessment on the cardiovascular system. This is for Winston-Salem, the RN-BSN online program. Knock, knock, knock.
Hey, nurse.
Hi, Mr. Tatum?
Yep, that's right. Channing Tatum, that's me.
Channing Tatum, nice to meet you.
Thanks.
What brings you here today?
Well, I was having some heart issues.
What kind of heart issues?
Well, I do a lot of stuff on sets, and I sometimes overexert myself a little bit. And I just feeling some faintness of breath, and I asked somebody on set, and they said something about palpitations.
Oh, you've been having some heart palpitations.
Yeah, I guess that's what it is.
Okay, well, the doctor will be in to see you a little bit later, but right now I'm going to ask you a few questions and do a quick assessment of your cardiovascular system and kind of just check over your body, and you just kind of tell me what you have going on, and we'll go from there. Okay?
I'm used to people checking over my body.
Well, Mr. Tatum, let's get down to business.
Okay.
So, a few quick questions. Do you have any drug allergies?
No.
And these palpitations that you feel, have you noticed any consistency in when they're happening?
Usually when I kind of overexert myself a little, or most of the time, but sometimes lately they've been happening more often.
Okay. That's definitely something to not take lightly. And I'll pass all that information on to the doctor. Do you have a health history of any kind of cardiac issues, any murmurs as a child, or?
No. Child's murmur a lot, but I didn't have any murmurings with regards to my heart.
Okay. What about a family history of any heart disease?
Yeah, my grandpa had like 4 heart attacks, and they didn't kill him, but he had 4 of them. And then my other grandpa died of an aneurysm, which I think is cardiovascular in nature.
Okay, an aneurysm and heart attacks.
Yeah, and then my grandma had a stroke.
All right, so we've got
screwed on both sides here.
Heart attacks, stroke, and aneurysm. These are not good for this patient. Well, yeah, that's definitely something to keep in mind considering your family history. What about how you live your life? Are you a smoker?
No.
Do you drink a lot or regularly?
No.
Okay. What about physical exercise?
Well, I used to, but the role I'm doing now, I've had to put some weight on. And so I haven't really been doing that in a long time.
Well, that could also be why a big shift in body weight can really affect the pressure on the heart.
Yeah, a pretty big shift here recently.
All right, well, how about any shortness of breath? You've been noticing that?
What? Yeah, sometimes it's harder to breathe.
When you sleep at night, do you have to sleep with any pillows?
Oh, yeah.
To sit you up a little
I
bit?
like pillows when I sleep.
But you have to prop them up behind your back so you can breathe.
No, I probably haven't gotten to that point yet.
Okay. Well, that's good. What about edema? Do you notice swelling in your hands or
I don't know
feet?
what edema is.
Edema is swelling. So you can get swelling all over your body, but specifically, have you noticed any swelling in your hands or in your lower extremities?
Not too much.
Not too much. Okay, well, that's good then. What about in your neck? Do you notice any pulsing or swelling?
Sometimes pulsing, but not swelling.
Okay.
Or what you term as edema.
Edema.
Oh, edema.
That's right. All right. Well, Mr. Tatum, I'm going to have you lay back here on our medical bed.
Which way?
You can rest your back up here against this pillow.
Okay.
And I'm just going to do an assessment starting from your head down to your toe, all related to the cardiovascular system. So first I want to start with feeling the temporal vein. And I feel it pulsing. I'm going to have you look up, and I'm going to check the jugular vein to see if it's distended, which can be a sign of right-sided heart issues where the blood is backing up. And Mr. Tatum does not feel swollen. There is no jugular vein distension. I realized that in my notes, my medical assistant had taken your blood pressure, and it was 155 over 95. That's getting high for a young guy like you. Do you take your blood pressure regularly?
No.
He does not take his blood pressure regularly. This might be something, considering your current heart palpitations and your family history and this big weight shift that you've taken on, that you might want to start monitoring your blood pressure more regularly for, one, your baseline and any shifts, or to correlate if your blood pressure is changing in relation to how you're feeling.
Okay.
I'm going to continue on with your vital signs and veins. If I can see both of your wrists, please. I'm going to feel his radial pulses, and for a full minute to get his resting heart rate. Your resting heart rate, Mr. Tatum's resting heart rate is 77, which for a resting heart rate is kind of high and has me a little bit concerned. It's not really high, but for a resting heart rate, we like it more around 60.
77?
77.
Yeah.
Let me just feel these again and make sure that they are equal. His radial pulses are equal and non-bounding. They feel normal in rate and rhythm. I'm going to make my way down and check. Now you spread your legs just a little bit. And I'm going to check his femoral arteries. And they are present. And any pain or swelling in the back of your calves? Do you feel any heat or pain when I press there?
No.
No heat or pain. I'm going to check his dorsalis pedis pulse on the top of his foot, on both sides, to make sure they're even. They are even and regular, non-bounding, as well as his posterior tibial pulse, which is on the inside of the leg, behind the ankle, called the medial malleolus. And they are present and equal. I can see your hands for just a minute. I'm going to check capillary refill. We like it to be under 3 seconds on all of the extremities. It's showing that the heart is working effectively. When I press down on your finger, Mr. Tatum, it goes white. And then as the blood refills into your fingers, it turns pink. And it looks like your capillary refill is within 2 seconds. And that's just perfect.
Yeah, perfect.
Check down in your feet. They say you're perfect.
Yep. Some people do.
My sister is quite a fan of your work, Mr. Tatum.
Oh, thank you.
All right, capillary refill looks good. Let me go ahead and listen to your heart. Isn't that what's most important?
Oh, yeah.
You're quite the heartthrob.
That's right.
I'm going to listen to his heart, starting at the aortic arch at the second intercostal space. This is where S2 is the most loud. Then I'm going to move over to the pulmonary area at intercostal space 2 on the left side. And then down to Erb's point at intercostal space 3. And then the tricuspid at intercostal space 4. And then down to the mitral, which is, or the apical pulse area, which is the intercostal space 5. And this is the most accurate for heart rate. It's also where S1 is the loudest, and in all of my listening areas, S1 and S2 are present. They are equal in rate and in rhythm. So everything sounds good. I don't hear any palpitations this time. Have you felt any while laying here?
Only when you first walked in the door.
Well, I'm glad that they've passed. Let me just make sure I don't see any edema in your hands. You said you weren't feeling any. I'm just going to check your legs along your shin bone and down in your feet. They look normal, +2, +1. Maybe just a teeny bit, but nothing to mention. Do you have any questions for me?
So if I'm looking okay right now, what's, like, is it just a heart issue when I, like, exert myself, or, because I'm used to working out a lot, but I can't anymore, because of how I've let my body go.
Well, I'm hoping that this, whatever movie you're filming that's made you put on this weight, hoping that'll be a short time thing. And even though your vital signs and your blood pressure have all seemed to increase with this weight gain, putting on weight really quickly is very hard on the heart. And for that reason, you want to, as soon as possible, get back into a good lifestyle of healthy living, a proper diet, eating vegetables and protein, and getting 30 minutes of exercise regularly per day. Hopefully you can get the physique back that you once had in your youth.
I'm thinking about getting on Biggest Loser, seeing what I can do.
Channing Tatum on Biggest Loser. Okay. Well, there's one more thing that I do need to check. I know this can be a little bit awkward, but I'm going to have you roll to your side. And I just want to check for sacral edema. This is an area that I'm not too concerned about in a young man, but in an elderly or somebody who lays in bed more and has heart issues can be problematic because, one, everything can pool here where pressure is, but it's also a big point for pressure ulcers. No sacral edema is noted. All right, I'm going to have you go ahead and stand up, Mr. Tatum. And I'd like you to jog in place for 30 seconds. Ready, go. Jog, jog, jog. This is kind of a mini version of a stress test. Are you feeling any palpitations?
I guess.
You get? Okay.
I'm not smart. Don't really understand what a palpitation is.
A palpitation is kind of when you feel your heart skip a beat. Not necessarily pain. Okay, you can stop now. And you can sit back down. And I'm just going to listen to your heart rate again and see how much it's increased. So just after 30 seconds of light jogging, Mr. Tatum's heart rate is up to 90. That's getting closer to our 100 borderline, and I would definitely recommend continuing this consultation with the doctor and moving on to a change in lifestyle after this movie is over.
Okay.
Okay?
All right.
Can I answer any other questions for you?
No, that's fine.
All right. This concludes our cardiovascular physical assessment. Just to recap, we have covered the heart, the typical vital signs related to the heart, of heart rate and blood pressure. We've checked edema. We've covered all of his pulses from head to toe, and they are all within normal range, equal in rate and rhythm. And other than being out of shape and putting on weight pretty quickly, seems like Mr. Tatum's pretty healthy. But because he has concern of his palpitations and his heart skipping a beat with exercise, it is something of concern with his family history. And we would recommend a continued consultation. Thank you for watching, and I wish him the best in healthy living and a happy heart.